So now we will pass to the keynote presentation for session 2. It will be on folic acid fortification, a roadmap for change by Professor Kemel Ghotme. Professor Kemel is a pediatrics neurosurgeon and associate professor at the University of Las Havana in Colombia. He led a transitional neuroscience and mental health research group, and his global health work focuses on advancing evidence-based policies to prevent neural tube defects through large-scale food fortifications. And he had been actively engaged in the international advocacy works, including implementation of the WHO resolution on folic acid fortifications, and collaborate with multiple global partners to strengthen the science policy translation and community engagement in public health. Professor Kemel, the floor is yours. Thank you.
Thank you, Ebenezer. Thank you, Charlie, and the organizing committee for this kind invitation. I'm happy to share with you some experiences in how to materialize community engagement in achieving change. So that's the roadmap that I'm planning to show you in the next few minutes. I want to start with Francisco's story. He is a young boy that was born with a large myelomeningocele in the lumbar region, and it was detected very late in the third trimester of gestation. And even though today fetal surgery can be the first choice for indicated cases, this was not the case for Francisco. So he underwent a surgery in the first 24 hours of birth, and it was very successful. But despite the successful intervention, during his lifetime, Francisco will face many difficulties, including hydrocephalus, Chiari malformation, scoliosis and kyphosis, tethered cord, limb deformities, problems with the bladder and bowel, walking disability, and will need to be admitted to the hospital several times and undergo multiple interventions. In addition to that, there are psychosocial issues, as my predecessors explained very well in all of the aspects of this patient's life. In the world, 3 of every 1,000 babies are born every year with a neural tube defect that can range from very severe malformations such as craniorachis and anencephaly up to spina bifida occulta. But this is just the tip of the iceberg because we are just counting the live births, but there are misclassified neonatal deaths, stillbirths, selective terminations, and early fetal losses that are attributed to neural tube defects. Good news is that most neural tube defects are preventable. Up to 80% of them are preventable. And as Sylvia very well mentioned, this is something that we need to emphasize. It can be prevented at the individual level by dietary diversification, health literacy, and awareness. At the clinical practice level through folic acid supplementation, good nutritional status, follow-up counseling, etc. But at the public policy level with large-scale food fortification, which is the most successful public health evidence-based policy to prevent folic acid sensitive neural tube defects, which is the case folic acid deficiency or insufficiency before the time of the closure of neural tube defects, the main cause of these congenital malformations. Large-scale food fortification is practical because it improves the folate status of women of childbearing age before they get pregnant, and without requiring changing a behavior to start taking a pill from not doing it before. It is safe because there are no adverse consequences from the standard amounts used for fortification. It's feasible because countries do not have to invest in infrastructure, machinery, etc., just to apply the premix of micronutrients, and it's cost effective because fortifying 1 metric ton of wheat flour, for instance, costs only $6 American. It also prevents cleft lip and palate in more than 60% of the cases, major congenital heart defects, several types of anemia such as megaloblastic anemia in the productive population in young adults, and certain types of dementia in the elderly. And even more, it has social impact because it helps countries to achieve their sustainable development goals for 2030, including zero hunger, because micronutrient deficiencies are considered a hidden hunger, good health and well-being, and also reducing inequalities. Or don't you think that there is nothing more unequal than being born with a severe congenital disability when this could have been prevented? Again, good news. In the world, 62,000 babies are being protected every year from neural tooth defects from being born with them by fortifying food with folic acid. The bad news, again, is that it's only less than a quarter of those that could have been prevented. And why? Because even though we have solid evidence for more than 30 years in the world, only 92 countries have enacted a policy for mandatory fortification of staple food. And from those, only 63 so far include folic acid in their fortification standards. Knowing this and applying translational science, we developed a strategy and a roadmap to change. The 5 pillars were knowledge translation strategies conveyed to key decision makers. So we started with Latin America, but then that spread worldwide. We developed an advocacy toolkit to facilitate the process. We use policy entrepreneurship models and strategies, science diplomacy mechanisms, and of course, and very crucial in the process, stakeholder engagement. The Neuroadvocacy Toolkit uses knowledge brokers, such as key opinion leaders in pediatric neurosurgery, that use that to facilitate the knowledge translation to knowledge users that were policymakers, state agents in Latin American countries. And then we use top-down and bottom-up approaches, starting with the leadership level, government officials, policymakers in the ministries of health, and lawmakers and Congress members. And then we approach also the mid-level officials, such as technical officers, policymakers assistants, and lawmaker assistants. Then when we had the first meeting, everyone was speaking the same language. And with a preeminent figure of gatekeepers, we were able to meet with all of them and convey the message in a very effective way. We navigated with a roadmap jointly built by the Ministry of Health of Colombia, the Ministry of Foreign Affairs, and the diplomatic mission in Geneva, with the counseling of the scientific community and the advocates in pediatric neurosurgery. We moved then to grant stakeholders engagement, and at the end, with the concourse of entities such as GAPSB, GAIN, Micronutrient Forum, and many others, we obtained an endorsement letter from the civil society and supranational organizations, 75 signers that range from UNICEF, the most prestigious university, to patients and families associations. This letter was delivered to all of the ministries of health of the 194 member states of the United Nations. So when we got to the WHA, the World Health Assembly in Geneva, May 2023, everyone had this on the radar, and this was a resolution that was considered a green resolution. There were very few and very mild objections to the project. So after 4 years of hard work, we were granted 1 minute to address the WHA at the floor of this meeting. Let me confirm that we have audio.
Not yet, Prof. Not.
Okay, I stopped sharing and I will be sharing again.
Okay.
Okay, so this was the 1 minute that as civil society we had to approach the 194 ministries of health.
Honorable Chair, distinguished delegates, the WFNS is pleased to support EB Decision 15230 to accelerate efforts for preventing micronutrient deficiencies and congenital malformations to safe and effective food fortification led by Colombia and other 35 member states. Micronutrient deficiencies drastically diminish individual survival, health, and quality of life, and impact families and society unfavorably. Food fortification with micronutrients, the most effective, safe, and inexpensive preventative intervention, is readily available and requires simple technology. Still, many countries fail to implement this evidence-based policy adequately. The cost of inaction is profound and disproportionately affects vulnerable populations worldwide. We are fully committed to supporting large-scale food fortification policies, implementation, scaling up, surveillance, and long-term sustainability. This resolution will assist member states in reaching the Sustainable Development Goals by decreasing morbidity and mortality, preventing hidden hunger, and promoting health equity. We urge this Assembly to approve it and help thousands of children to start healthy and fulfilling lives. Thank you.
Then member states made all of their arguments. All of them were in favor of the resolution. And at the end of the process, we got the final voting that I'm showing it now.
We will now look at the draft resolution entitled Accelerating Activities to Put an End or Reduce Micronutrient Shortages and Their Shortfalls, which includes spina bifida and other effects on the neural tube via proper enrichment of food, as recommended by the EB in its decision EB 152-13, which is in document 152/2023/Rec/1. Is the committee in a position to approve the draft resolution in decision 152-13? Seeing no objections, the resolution is approved.
So this is an unprecedentedly fast-track approved resolution by the WHA, and the reason for that to happen was precisely the community engagement and the conversation, articulating dialogues with governments, government officials, with the scientific community, with representing all fields, including nutrition, genetics, obstetrics, neurosurgery, pediatrics, etc., but also NGOs and Families and Patients Association. Having a resolution is not the end of the process, it's just the beginning, because then we have to continue working in different aspects. But the anticipated impact is to prevent at least 200,000 babies born with a neural tube defect every year worldwide, and also preventing 60,000 of elective termination due to this reason globally, leading to improving population's health and well-being and allowing to reorient resources and efforts to conditions that are not so preventable. And still, we know that we cannot prevent all cases, but we can then treat them better because we can reallocate resources. These are the 8 recommendations by the WHA resolution that I have to share at any moment, but we have to focus in education and awareness, fortification and monitoring, that the fortification actually happens, promotion and prevention of health initiatives, collaboration among different stakeholders, surveillance, screening and treatment, financing, and periodic reporting. From 2026, member states will report to the WHO Director General what are the advances in implementing this resolution, and the Director General will present the results to the WHA at large. I want to tell you the case of Ethiopia, country with around 120 million inhabitants, that have 40,000 neural tube defects per year as new cases. Of them, 10,000 are born with spina bifida, but due to the limited neurosurgical staff, equipments, and resources, they cannot deal with all the cases. So many patients die or are left without treatment. Despite efforts from the government and NGOs, they couldn't handle the epidemic that these congenital malformations represent for this country. But then, with support of the resolution and the whole process involved, Ethiopia enacted a new regulation for mandatory food fortification, starting with wheat flour with folic acid. The mathematical models estimate that in the next 3 to 5 years, we will have 8,000 cases of neural tube defects less per year. So this is the dimension of how this preventive measure can achieve. In addition to Ethiopia, we have ongoing activities in India, Turkey, the Philippines, Mexico, Nicaragua, Portuguese-speaking African countries, Pakistan, Lebanon, and some Latin American countries as well. But we need to continue work with stakeholder engagement. Policymakers by promulgating, enacting, and enforcing, and also not repealing fortification laws, and monitoring and evaluating. Millers and the food industry by fortifying on a regular basis, monitoring that fortification process, and changing the packaging so the consumer will know that fortification is happening. Consumers to be aware of neural tube defects and other micronutrient deficiencies and accepting, buying, and consuming the flour and byproducts, and for healthcare providers to continue motivating to discuss fortification with patients and steadily supporting and promoting fortified food. A major breakthrough also happened after the resolution. In The Hague, in October 2023, the milling industry built an alliance of their partners. And this coalition is supported by a range of players from across the food fortification value chain. What is the goal? To voluntarily fortify the staple foods with micronutrients. And that involved 8 countries: Bangladesh, Ethiopia, India, Indonesia, Kenya, Nigeria, Pakistan, and Tanzania, with 3 foods: flour, oil, and rice. And covering these 8 states will cover the 30% of the world's population. So they are not waiting for the local authorities to enforce fortification. They will just start fortifying, and that will help us gain valuable time in preventing this congenital malformation. The essential messages is that data-driven advocacy and knowledge translation toolkits help to transform our role from being passive stakeholders to active change agents. Using scientific methods help to identify needs, barriers, and facilitators when promoting policy change, and that we can convey strong messages to crucial decision makers by using our pillars of knowledge transfer, toolkits, policy entrepreneurship strategies, and science, diplomacy, and of course, involving all of the key actors in the chain. Advocating for primary prevention, though, by no means imply impairing continuous efforts to provide quality, humane, and person-centered care to individuals living with neural tube defects. Quite the opposite. Individuals like Francisco generate a source of inspiration to expand the horizons for us to find innovative ways of generating change in a more systemic reach. My call to action today is to help ministers of health in each country to adopt, implement, or scale up the fortification policy, if they already have one, to advise country officials in preparation for the first reporting of progress to the WHO that is going to happen in May 2026, and aid LMICs in identifying sources to strengthen monitoring and long-term sustainability of fortification programs, with the ultimate goal of saving thousands of children from being born with a devastating but preventable condition and promoting a healthy and fulfilling start to their lives.